Right back live with Kgosientsho in Focus, and thanks for staying on. Electricity Minister Kgosientsho Ramokgopa has visited some healthcare facilities to assess the impact of load shedding. He emphasized government's commitment to ensuring sufficient supply to facilities during rolling power cuts. For more on this, we're joined by the South African Medical Association's chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good to have you. Thank you very much for coming on tonight. As we speak, we are seeing reports, certainly from Eskom, that the levels of load shedding are going to be ramped up in this coming week. This as the minister was, of course, meeting the Gauteng Health Department and made some promises. I mean, first and foremost, do you believe in any of those promises being made a reality for hospitals in the province?
Good evening to you, Thabo, and to your viewers. We are very disappointed, that they are still talking about exemption of hospitals when actually this was announced sometime last year already, when the minister called a media briefing and promised the nation that hospitals will be exempted from this. So all they do is go to the media, make promises and disappear. That's all we see. No implementation of anything.
Why are we failing to hold them accountable to what is already in place? Never mind anything extra, but we just can't seem to be holding them accountable to that bare minimum to say hospitals, it's already been declared that they must be exempt.
This government is quick to point out that, economically we are losing about 2.5 trillion from 2018 on load shedding. But they are failing to even investigate how many lives have been lost, because of load shedding. So that is what, would want government to do if they are really truthful and honest and transparent about, how they are dealing with South Africans. It would be good if the president would pronounce on an investigation on how many lives have been lost due to load shedding, and then we can take it from there.
Yeah. Talking of that, I mean, we are dealing, for example, with a cholera outbreak. It's in Tshwane, but obviously it's affecting a whole lot of facilities in Gauteng where some of the patients are being transferred to. I mean, dealing with something like cholera and dealing with electricity shortages or a power crisis, how difficult does that make the work of the healthcare practitioners?
It's actually very demotivating, if I may put it so, because all you see, Thabo, is politicians running like headless chickens to Hammanskraal, and they present themselves there, make empty promises and leave Hammanskraal. I heard that the president is going there as well. I don't know why is the president going there, because they should be sending people to fix the water. People in that area don't want warm bodies. They want clean water. And then, like you said, the impact is huge on healthcare workers. You remember that there's a shortage of healthcare workers. If you don't have electricity, you've got problems with monitoring. You've got also problems with critical medical machinery. You've got all these other problems that you have. And even the issue of infections in the hospitals, they cannot be managed well if you have all those serious problems like water and electricity shortages. So those are the problems that healthcare workers are facing. And unfortunately, in most cases, as you have heard, even in the northern province, the blame, in most cases, it is referred to the healthcare workers. They are used as scapegoats because this government is not willing to, take responsibility and be true to its constitutional mandate to protect, promote, and maintain the health and safety and the well-being of patients in the hospitals. That's the mandate of this government.
Some powers have now been given to the electricity minister in terms of being able to make some procurement of energy. I mean, looking at the power that now lie with him and him holding these meetings with health departments, what would you suggest he uses this power for?
To expedite delivery of services like provision of electricity, that's the outcome that we need. That is given powers or powers taken away from him, I think does not help South Africans. All we need is to see, electricity being restored. We all want to see patients being saved in the hospitals. I mean, it's not helping for these politicians to keep quoting other politicians who died a long time ago. Like in last year when the minister made a speech, he quoted one of the American politicians that their duty is to save lives. But what are they doing? Are they really saving lives? There's no saving of lives in what we see. What we are sure of, as I speak to you now, in the hospital, there are challenges of safety and security because of load shedding. And those things that should be taken serious. The issue of safety and security for patients, for healthcare workers, and for everybody who's in the hospital setting. The other problem that we face is the problem of babies. There are babies, premature babies, who may be exposed unnecessarily to cold environments. How do you explain a premature child not having a warm environment, which is normally provided by, an electrified environment? The issue of critical medical machinery that has been broken down because of this load shedding issue. The postponement of surgeries or operations that have been put on hold, indefinitely in most cases, because people don't take a responsibility, making sure that they're exempting these hospitals. Instead, they keep on making promises and promises and promises. This is crucial for us because there is a serious compromise on patient care when it comes to load shedding.
I want to raise the issue that you just raised now as well, in connecting it with what you are saying, critical medical machinery that is lacking, heat, for example, that is lacking for premature babies, and the story that is currently being investigated by the Northwest Health Department. Are you suggesting there, Dr. Mzukwa, that sometimes healthcare workers are trying to make means and make a plan? Unfortunately, in this case, it's cardboard boxes, which many are saying has compromised the health of workers. And you're saying this is due to the insufficiency of the support that they need to get as far as these essential products are concerned.
You will know that it was noted by the health ombuds that some of these CEOs are not competent. It is out there. It was read out to us in the report of the health ombud. Secondly, when this, the lower managers report to senior management, they are usually intimidated. In most cases, I mean, you find clinicians calling out other hospitals, looking for bed availability and other equipment, when actually that is supposed to be done by the CEO. The CEOs of this country are sleeping when the hospital is running 24 hours. We believe that, there should be enough support. It's not enough, to be using healthcare workers as scapegoats like it is happening now. Already at Hammanskraal, we're hearing that people are blaming doctors and nurses that they are not doing enough, when actually the problem is the water that has not been supplied by politicians. In those areas where you find that children are put in boxes, you will find that the actual cause is that there is no response from the senior management. They have been told many times that equipment on the ground, there's a shortage, but they will not take that into consideration. Instead, they will be driving around, attending endless meetings, and nothing that comes out of those meetings.
Yeah. It's not a question of meetings, it's a question of what solutions are in place. And from where you sit, and I've heard other health practitioners as well saying, for example, there is some equipment that begins to be compromised as this load shedding happens and they are run with generators. It's just not sufficient current for some of these equipment to actually function optimally in how they were created for. So your suggestion really is the implementation of the exemption of all hospitals, and that's what you are calling for.
Yeah, Thabo, there's many other issues there. You're talking about the safety and efficacy of certain medications, and vaccines, like your insulins. They need a cold chain. If there's no electricity, it means you're breaking that cold chain. There's many issues, like I raised initially. You are compromising the lives of patients when you continue load shedding. So our view was that we are not going to be told that it will happen in the future. We are thinking that people are going to come and say, we've already exempted hospitals. This thing of promising and saying we will, they've already said it a number of times since last year. By now we should be told as a nation that all the hospitals have been exempted. All these excuses that are put before us are really not assisting at all.
Dr. Mvuyisi Mzukwa, appreciate your time. Thanks for coming on, chairperson of the South African Medical Association. They're weighing in on that meeting that the Minister of Electricity had with the Health Department here in Gauteng, and him being, of course, updated and being made aware of the challenges that hospitals are facing because of the rolling power cuts that continue. All right.